Hi, Dr. Harrison here, and today we're going to talk about disc herniations. If you're watching this video, you're probably suffering with a disc problem, maybe a disc bulge, maybe a herniation, maybe what they call an extrusion or a prolapse. So I just want to talk about the different stages of disc injury and how we go about treating those in the office, maybe what some of the treatment options are. So let's talk first about disc bulges. Disc bulges are probably the earliest sign of a disc problem, and they are identified specifically on MRI findings, even though we might see some signs on a plain film X-ray. The definitive diagnosis would come from an MRI. And in a disc bulge, I kind of relate that to a car tire that might be slowly deflating. As the tire starts to deflate, the edges of the tire start to bulge out. Well, that's what happens with the disc. It's sitting between two vertebrae, whether it's in your neck or in your low back, and as the vertebrae come closer together or that disc starts to bulge outward, it's kind of like that tire on the car. The outer fibers are pushing out, and that's when they are more prone to irritating nerve structures in the area and creating local pain or sometimes radiating pain, whether it's down the arm or leg for the patient. Those types of disc problems respond very, very well to chiropractic adjustments and just standard physiotherapy, whether it's muscle stim, heat, ice, therapeutic exercise, stretching, maybe some massage. These types of modalities all work very, very well to handle minor disc bulges. And in fact, some people with disc bulges don't even know that they have them because they have no symptoms at all. So that's the number one and probably the earliest sign of disc problems that we see in the office. The second would be a disc herniation. A lot of people call that a slip disc, and the discs don't actually slip. They either start to bulge or collapse, or they herniate. And the herniation is an actual tear in the annular fibers of the disc. The disc is made of two components. It has the outer annular fibers, which is a fibrocartilage. You can almost think of it like a jelly donut. And the internal part is what they call the nucleus. It's made up of mostly water, probably about 88% water, and maybe 10% sugars and other enzymes in there needed to keep the disc healthy. Well, in a healthy disc, all of those annular fibers are intact, and that nucleus is very well contained. And that nucleus kind of serves as a fulcrum. So when the two vertebrae are sitting on each other, as we bend and turn and twist, we're pivoting around that nucleus, which is that liquid center. Well, in a herniation, some of those annular fibers have torn. Usually it's posterior and lateral, and the nucleus starts to migrate through that tear, and we start to lose some water content because it starts to evaporate out of there, and the disc starts to collapse. When that happens, well, we find we can't move too well anymore. We start to get very stiff. Or when it goes posterior and lateral, those are the areas where the nerve roots sit. So we might get nerve irritation on one side or the other, and that's when we start to get lower back pain, radiating pain down the legs, sometimes numbness or tingling. So from a treatment standpoint, or an observation standpoint, I should say, when people come in, sometimes we'll see they're leaning away from the pain. Very, very typical presentation in a disc patient is to be forward flexed and a little lateral because it takes pressure off of that nerve as the disc is pushing into the nerve root. So our job is to try to reposition that disc, get the vertebrae standing back or back level instead of laterally flexed, which many times we'll see on the X-ray, and get that patient standing up straight again. Disc herniations can be pretty finicky. I've seen people with disc herniations who have no pain at all, and then I've seen people with disc herniations who are in severe pain, and there's really no rhyme or reason. I've seen people with a full-blown herniation that you think, you see direct pressure on the nerve root on the MRI, and you'd think they would be in tears, and they're walking around with no pain at all. And then you have another patient with a minor disc bulge, the first scenario I told you about, and they have, they're in tears, they're in so much pain. So disc presentations can come in all variations, and you just really have to approach it from a very personal standpoint the way the patient is presenting to you, and treat it accordingly. The second form that we talked about, the disc herniation, is the type of injury that sometimes people will have back surgeries for. There is an alternative to that, and that is spinal decompression. And spinal decompression helps to repair that nucleus and help restore the pump mechanism. I discussed that on another video, so I'm not going to go into that here, but you can look at our spinal decompression video, and I explain that in a little bit more detail about how that pump mechanism works and how we go about repairing that. And let's talk about the very last or worst stage that's almost always a surgical situation, and that would be a disc prolapse or an extrusion, they call it. And an extrusion is where that nucleus or liquid portion of that jelly donut has pushed all the way through the fibers, and now it's out into your spinal canal. And in some cases, you might even have a free fragment where it's separated from the rest of the disc and nucleus. That free fragment floating around, or that extruded disc, almost always is going to be a constant nerve irritation. Typically, the only way to alleviate that nerve irritation is to go in and remove that extruded fragment. Those are the types of disc problems that will be a contraindication for spinal decompression. And so if you have a free fragment or an extruded disc, typically we're going to say that you're not a good candidate for spinal decompression, which is unfortunate because spinal decompression, in my opinion, is really the best formula for treatment for a disc herniation or a disc bulge that's symptomatic. Again, chiropractic can be very, very helpful. Many times we have great success with it, and it's a cheaper way of approaching treatment for these types of conditions. Spinal decompression, though, we can't hold a candle to it because it helps repair that pump mechanism. So you want to find out more about that, go to our spinal decompression video. I hope this helps clear up some information on disc injuries for you. If you have any other questions, please feel free to call the office or log on to our website at orlandochiropracticrehab.com. And I look forward to helping you here in the office. The consultations are always free.